So the topic for today is mainly the vildagliptin, one of the DPP-4 inhibitors used as an anti-diabetic drug. We all know that the DPP-4 inhibitors actually acts by inhibiting the deactivation of GLP-1. This is one of the incretins which is released in the GIT in response to the sugar and the food we ingest in. And this DPP-4 enzyme actually destroys the GLP-1. And if we inhibit DPP-4, so the destruction or degradation of GLP-1 is prevented, and hence you have a higher level of GLP-1 available. So what these group of drugs, all these members of this group will actually do is that they inhibit DPP-4 and prevents the inactivation of GLP-1. Thus, elevated levels of GLP-1 increases insulin release and also inhibit the glucagon release at the same time. So they help in controlling the sugars. So the glucagon causes hyperglycemia and the levels of glucagon is low. So it does not cause that. And obviously the insulin release and insulin action we already know. Some of the members of this group are sitagliptin, allogliptin, and linagliptin. They acts by binding competitively to the enzyme, and whereas the saxagliptin and vildagliptin binds covalently with the enzyme, and that is how they actually show their action. The use of DPP-4 inhibitors improves both fasting as well as postprandial hyperglycemia. They are often used as adjuvant in type 2 diabetes mellitus. Most commonly, along with even the combinations are available with metformin, but you can use with most of the oral anti-diabetic agents. And in type 2, it is also being used along with insulins also. They are pretty safe. We all know that. However, very few patients report allergic reactions, especially patients on sitagliptin. Hepatotoxicity is little more commonly seen in patients who are on vildagliptin, but the advantage of vildagliptin is that the drug-drug interactions are extremely rare with this particular compound. There have been a slight fear of pancreatitis as well as pancreatic duct metaplasia, cardiac arrhythmias, and rhythm abnormalities, especially with teneligliptin. But most of these side effects, which I have mentioned, are only in case reports, I believe, but I'm not sure whether I had any time to kind of stop the drug because of any of these side effects. So they seem to be pretty safe to be used. Talking of safety again, as we know, for all the drugs, especially the anti-diabetic drugs, they need to be cardiac safe, and this bar chart actually shows that there are three major adverse cardiac events, that is CV death, non-fatal MI, non-fatal stroke, and fourth one added is hospitalization for unstable angina. They were not very different as compared to the other drugs, especially the glimepiride is compared here. So they are pretty safe from the cardiac point of view also. The major advantages of DPP-4 inhibitors seems to be they provide you a modest glycemic control, not a very strong anti-diabetic agents, I would say, but it do provide a modest glycemic control. You do not see hypoglycemia, which is a big advantage, especially for patients with renal disease and having renal insufficiency, because hypoglycemia is pretty common in them. So hypoglycemia is not seen in this group of drugs. So that is a safety feature we have in these drugs. It is weight neutral. All these members of this group are actually weight neutral. They do not cause gain as well as they do not cause loss of the weight. They can be used with the other drugs. I have already said that. May be used in all stages of renal disease. We will discuss little in detail how the dose modifications are actually required, and they are quite safe even in patients with renal disease. However, high cost, at least to some of these molecules, at least till some time back, was a prohibitive kind of factor, but this is being taken off as of recently, and these only provides a very minimal, or we said that it was a modest kind of HbA1c reduction, but it is significant most of the times. Obviously, there is no weight loss that may be considered as a disadvantage over the other drugs like metformin. There has been a little concern about the cardiac safety, pancreatitis, and some derangements of the liver function. So you need to be careful, because most of these patients are anyway being monitored for many of these complications in diabetics also. So we need to be a little more vigilant, because we do not want any patient to have any kind of toxicity of the drug. If we talk of DPP-4 inhibitors in patients with renal failure, and there are 4 or 5 members shown here. One is linagliptin, then sitagliptin, saxagliptin, and vildagliptin, and teneligliptin is in the end. Sorry. So if we can see that linagliptin can be used in normal doses in all stages of renal disease, whether renal insufficiency is mild, moderate, or severe. Even patients on ESRD, you need not modify the dose. So the efficacy and safety is established in all stages of renal disease, including patients on hemodialysis. Whereas sitagliptin, saxagliptin, and vildagliptin, dose modification is generally required in moderate to severe renal insufficiency, but they can be used, especially the vildagliptin. And teneligliptin, the normal dose is 20 milligram. However, the significant dose modification is not recommended, but there is a low level of evidence of the safety in patients with impaired renal functions. So there is a problem with QT prolongation, liver enzyme elevations, and even hyperkalemia. So we better avoid using teneligliptin in patients who have significantly impaired GFR, say below 50 or 60 ml per minute. However, the dose adjustment may be required. It is often required in patients when we are trying to use vildagliptin or sitagliptin. This is the pharmacological profile of some of these members of this group. Sitagliptin is generally available in the used in the doses of 100 milligram in patients with normal renal functions. Saxagliptin is 5 milligram. Vildagliptin is 50 to 100 milligram. That means 50 milligram twice a day, because half-life is little shorter. Longest half-life we have is with the linagliptin, which is almost 122 hours. So the dosing frequency will vary depending on that. Similarly, we have already discussed the dosage modification in patients with renal insufficiency. So again, the same repetition of this same slide. I said that the teneligliptin, we need to look at the safety issues in patients with renal failure. And if you have a person with impaired hepatic functions, the use of vildagliptin and even sitagliptin need to be little more careful. And teneligliptin is not yet approved by US FDA, I believe. So the main topic or the drug to be discussed today was vildagliptin. Most of it has already been covered in the general description. Primarily, as I said, that the apart from the glucose control, safety of the drug is something which is extremely important, and a drug need to be safe if not as effective. So vildagliptin also has been studied in detail in many studies, both clinical as well as experimental, and the side effect profile, including all-cause mortality, incidence of new diabetes, and serious adverse event, and even the cardiovascular mortality has been found to be quite low. So pretty safe drug to be used, provided you select the right kind of patient. Similarly, the vildagliptin in patients with type 2 diabetes having renal insufficiency of various grades, that means person with GFR of more than 50 ml, 30 ml per minute, even patients with GFR of less than 30 ml, and even patients on hemodialysis, vildagliptin has been clinically used and tried in studies, and a significant reduction in HbA1c is being achieved in almost all these studies we can see. Apart from these clinical benefit of control of hyperglycemia, experimental studies, especially in the murine models, have actually shown vildagliptin to have additional pleiotropic effect, especially in patients with renal disease. So this helps in minimizing the tubulointerstitial damage, inflammation within the renal parenchyma, as well as fibrosis, and it also helps to reduce the apoptosis. So maybe they are also, apart from the control of sugar and helping that way in retarding progression of renal disease, they may be directly useful as a drug effect, or I would say class effect maybe, that they may help in retarding the progression of renal disease. However, more detailed studies would be required to prove that. They are quite efficacious as far as the glycemic control is concerned, without risk of hypoglycemia. This is something which is very important, because we are mostly worried about low blood sugars and patients coming to ER every day with altered sensorium, and you find that sugar is actually less than 50-30 milligram, and unnecessary hospitalizations. And they are weight neutral, and it can be used though with the modified doses in patients with chronic renal failure or renal insufficiency of various grades. They may be working as antifibrotic agents. Similarly, the levels of megalin are maintained, so the renal damage through the apoptosis or fibrosis, endocytosis and all are probably controlled to some extent, but this needs to be verified in further studies. Several patients cohort studies of murine models have demonstrated a selective, solid, direct relationship between urinary albumin excretion. So there seemed to be an impact on the urinary albumin excretion, which is one of the main presentation of diabetic renal disease. So it may help in reducing the proteinuria or the albumin excretion in these patients. So even in patients who were on hemodialysis, good control of both fasting as well as plasma glucose has been maintained by using vildagliptin and maybe sitagliptin. Vildagliptin 50 milligram monotherapy has been shown to be able to improve the postprandial glucose levels without any drug-related serious side effects in patients who are on hemodialysis. We routinely use them in patients who have undergone post kidney transplantation and having normal graft functions, obviously, and they are pretty safe there also. Vildagliptin treatment for 24 weeks significantly not only reduce the proteinuria and albuminuria in animal models, but also improve the GFR. So these are the areas which will warrant further studies probably, if this is true even in clinical studies. So that would be an additional advantage of using drugs like vildagliptin, because it has been seen that in experimental models, albumin excretion has been reduced by almost 50% in these with the use of these drugs. Effect of vildagliptin plus in the early obesity-related glomerulopathy. Obesity-related glomerulopathy is one patient who are obese with high BMI. They develop FSGS-like manifestations. So this is also being tried there, and we probably need more data on that also. So to almost conclude, that we know that how the DPP-4 inhibitors act, that this helps in maintaining the GLP-1 levels. This improves the insulin secretions and inhibits the glucagon synthesis. And this has an impact on the hyperglycemia, and then indirectly maybe working as anti-fibrotic agents and helping in maintaining GFR in these patients. So advantages are that there is a very low risk or almost negligible risk of hypoglycemia in these patients. A modest glycemic control, as discussed, can be achieved with these drugs in selected patients. They may help to reduce albuminuria. Certainly, there is a good tolerability and almost negligible side effects by these patients. So, DPP-4 inhibitors can therapeutically be useful in retarding progression apart from the sugar control of diabetic kidney disease. However, so far there is no conclusive evidence in clinical studies, but there is some evidence from experimental and murine models that they may be effective there also. So finally, I would end up by saying that vildagliptin with appropriate dose adjustment provides clinically important reduction in glycated hemoglobin without increasing weight, without putting patient on hypoglycemic risk, even in patients with chronic kidney disease, if you modify the dose adequately. And they may also help in progression, retarding the progression of diabetic renal disease and reduce proteinuria and possible pleiotropic effects in these patients. Vildagliptin is effective in all stages of chronic kidney disease for the sugar control, and they are also safe in patients with renal transplantation having normal graft functions.